This is an example of a conversation that you might see in a pharmacy.
Hello, ma'am. How can I help you today?
I'm here to pick up the drugs the doctor sent over.
Okay, let's see. Looks like we have one for Lipitor from a Dr. Barnes. Is that what you were expecting?
I don't know what it's called. The doctor writes it, he sends it over to you, you fill it, and then you give it to me. That's all there is to it, right?
Well, technically those are the steps that we take, but there is a lot more to it than that. You need to know about your drugs.
Have you ever been a part of one of these conversations or been around when someone else has? I sure have. I see them all the time. If someone gave you the wrong pill, would you know if you should take it or if it's the wrong one?
Being educated about our medications is extremely important. Some medications are taken as needed, but if you don't know what you're taking it for, how do you know if you need it or not? Other medications need to be taken at certain times in the day. For example, some are taken in the morning while others are taken at night. Still, other medications should be taken with or without food. If we aren't able to tell which medication is which, then we might not get the full effect that we need.
I don't know about you, but I don't like being told what to do. So when it comes to my health care, I want to be a part of the decision-making process. I don't just want a doctor to say, take this twice a day with food or without food. I want them to discuss it with me and us to make a decision together. But in order to do this, we have to be educated about our medicine. We need to make a decision right now to learn 4 things about our medication. We need to know the color, the shape, why we're taking it, as well as how we're taking it.
When you go to pick up your medications at the pharmacy, before you leave, you should be able to answer these 3 questions. 1, what is this medication for? 2, how are you going to take it? 3, what are you going to expect? If you aren't able to answer these 3 questions, then you aren't able to fully take care of your health. Taking a few minutes to talk about your medications with your pharmacist helps us to get informed and know how to best help ourselves. As a pharmacist myself, I want people to ask me questions. That is what I'm here for. Every pharmacist has a job to make sure that his or her patients get advice on their medications and are able to answer these 3 questions upon leaving the pharmacy.
If I were to lay out several tablets on the table in front of you, would you be able to pick yours out? Well, you should be able to. And then you should be able to tell us why you're taking it, as well as how you're taking it, and any special considerations along with that medication.
So here's an example of how the conversation should go. Hello, ma'am. How can I help you today?
I need to pick up the medication that my doctor sent over.
Okay. Looks like we have one here for Lipitor from Dr. Barnes. Is that what you're expecting?
I'm not sure. It's to help my cholesterol, but I do have a few other questions for you. How am I supposed to take this, and what should I expect while on it?
Sure. I'd be more than happy to take care of you today and answer the questions that you have about your medication. So the next time you're at your pharmacy, take full advantage of your time with your pharmacist. Let's all make a decision to become more educated about our medication.